On further good news, there'll be some changes on the aged care and home care front from that point of view, and which is good. And I think the government is recognising that there's a problem here, and they've got to do something in that space. Do you want to talk us through some of those key measures?
Sure. Well, last night's budget allocation, which was 3.7 billion for aged care, really was largely previewed already on the 22nd of April. Minister Mark Butler presented at the National Press Club, and so we got some media coverage at that time. So some of these changes might sound very familiar already. A billion of that was announced to cover the cost of moving some essential personal care costs like showering, dressing of wounds, and what's called non-clinical continence management. From 1st of October, they'll be moved from the independence category to clinical support. Fundamentally, what that means is people will no longer potentially have to make a co-contribution towards getting help with those things. And that's can be quite expensive at the moment. Some people have to pay 50% towards those hourly rates, and those hourly rates are often over $100 an hour. So this will be a very important change, and hence it's going to be a little bit costly, $1 billion there. They're also going to bring forward some of the placements that we were going to see with support at home. So additional packages, they're going to be brought forward because we do have quite a problem with waiting lists. $200 million was announced as part of that 3.7 billion to help with 20 new specialist dementia units, and expanding a hospital to aged care dementia specific program that only started in 2025. That program has already helped 700 people leave hospital and move into dementia specific care. So really great outcome for those people, but certainly need more funding in that area. And then the remaining part of that 3.7 billion is going to a variety of things like constructing 5,000 more aged care beds over 4 years, upgrading buildings, enforcement of the sector, some computer system upgrades, and a range of other smaller elements.
Okay. Well, look, and unfortunately, this seems like an endless bucket with aged care in terms of how much can you keep on throwing into it. But I guess from a practical perspective, are these changes directionally positive for older Australians? Like trying to navigate this system. Are these a good thing, do you think?
Oh, look, these are important spending areas. They are positive, but as you say, it's arguably a drop in the ocean. In 2025, we had estimated 176,000 people living with dementia in Australia, and over the next 20 years, that's going to go up to 422,000. Yeah. So 20 new residential units is a drop in the ocean to deal with that. So we certainly are going to need a lot more spending in this area. And then the question is, how to pay for it. And fundamentally at the moment, there are 200,000 people waiting for either aged care beds or packages to be able to commence. And wait times are currently 10 to 11 months. And the target was to get down to 3 months. So hence this bringing forward of some of these packages to try and have some of these people on waiting lists get onto their packages sooner. So look, really substantial problems in this sector. And the third one, I think really important to mention is bed wait times does reflect a particular change that happened back in November, which is really starting to, see the unintended consequence of that now. And that was the removal of targets for what we call low means people in the past. They're now called supported people. These are people who don't have a lot of financial means. And so there used to be a certain number of beds always kept aside for those people. That was scrapped. And so what we're starting to find is for some facilities, they're really picking and choosing and really looking for people who have the capacity to pay those RADs, those bonds by the old language, those big fat lumps up front. And so we're seeing people languishing in beds, often in hospital, or, they're at home struggling through and at risk. So this sort of area has also been addressed in the budget to a degree, but fundamentally, what we really need to see is going back to a system of requiring the provision of beds for low means residents, because quite frankly, if we look ahead at the demographics and people's finances, we are still going to have a substantial portion of people moving into care that will be qualifying as low means people. So this is an area that has only been partially addressed with the budget and needs much further work. Fundamentally, what they're going to be doing to try and encourage more beds for low means people is providing facilities with an extra small proportion or a payment per day if they are constructing and building more beds specifically for low means people. But that's a nice incentive. Financial incentives are good, but fundamentally it's not really going to be a short-term measure to deal with this particular problem. And fundamentally, aged care is always a bit of a tricky one, because we've got for-profit companies, right, operating in an area which is not profitable. It's not profitable to help low means people, right? And so this is always the conflict in this sort of sector. Yeah,
absolutely. Lisa, just from a funding point of view, and just focusing on what this was announced by Mark Butler, I think on the 22nd of April. In order to fund some of these initiatives in terms of aged care, what they were doing was removing the private health rebate, or the private health insurance rebate for older Australians.
Yeah.
So previously, older Australians were receiving a rebate and getting a discount, or paying lower than what somebody in their early 20s or early 30s would be paying because of the way the rebate worked. I was caught by surprise as to how big the rebate was in terms of its value. What's the unintended consequence of that? Do you think a lot of the Australian, like this, in a cost of living crisis, is the risk that a lot of older Australians turn around and go, I can't afford private cover and get off the system?
Well, before people make that assumption and decision, it is a estimate in the actual budget documents was that measure would change your premiums by $84 per $1,000 of premium. And so for the average person over 65, they estimated that would be about a $240 over a year impact. Now, that's unfortunately, they're not workers, most likely, and get the benefit of the tax offset on the other side of the way too. But look, nobody wants to ever pay an extra dollar. I appreciate that. But this was an area that is been costing the budget a lot of money. Jim Chalmers also connected not just the private health insurance change to helping fund the aged care side, but also, of course, NDIS. And it's always a bit of a tricky one when you cut healthcare spending to cover other healthcare spending in an aging population. Fundamentally, of course, we want to cut waste and, we want enforcement and things like NDIS, etc. But we need to potentially find other ways rather than butchering into the healthcare sector itself. Arguably the gas export tax proposal, other ways to find funds, will be popular with the electorate. And we've seen, some early polls and surveys where people are supporting ideas of that sort of nature.
Yeah, of course. Thank you for that, Lisa.